Disclaimer. This program is intended for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The following program is intended for mature audience only.
Hi, I'm Dr. Kathy Swain Jones.
Hi, I'm Dr. Denise Joseph Zollicoffer.
Hi, and I'm Sonia Williams Finney.
And this is
Menopause Diaries, real talk, real stories.
Welcome back to the Menopause Diaries, real talk, real stories. Thank you so much for joining us as we do a deep dive into menopausal symptoms, our menopause journeys. You know what? This is an awesome time in life. And for some of us, it's not that great. However, we are here to help walk with you through these times. Remember, this is real talk, real stories. So as we bring on our guests, you're going to hear the nitty gritty, the down and the dirty, all the things that you have been dealing with and wondering if you are the only one. So if you have joined us before, welcome back. We are so glad that you're joining us again. If this is your first time, you're in for a real treat because this is just an exciting time and we talk about stuff that we can all relate to. So welcome to Menopause Journeys, Menopause Diary, Real Talk, Real Stories. I am Denise Joseph Zollicoffer. I'm a nurse practitioner. And with me, I have my partners, Dr. Kathy Swain Jones. Kathy, would you just say hello? So they
Hi, good morning.
And along with Sonia Finney.
Good morning. Hello.
So now you've heard our voices and know that we're here and we're going to just have conversation. Today, we have the privilege of being joined by a wonderful woman who wants to share her journey. And, you know, let's not take it for granted because these are people who are willing to kind of strip themselves of their shame or fears and really share with us what they have gone through so that we can impact some lives around us. And women like us, we really, especially in the Black community, the women of color community, we really need to just be candid about the things that we are going through. So today we're joined by Janette Urubias. Hopefully I said your name right. She is joining us from Port St. Lucie, Florida. So Janette, you know, welcome to the podcast. I'm very thankful that you're here today.
Thank you for having me. Good morning, everybody.
Right.
How's everybody doing?
So we're gonna start at an interesting point for Janette because her menopause journey started with a perimenopausal baby. So she's going to start there and walk us through her journey. And of course, you know, like this is girl talk, really. So we're going to jump right in and interact with Janette as best we can. So go ahead and Janette and start with your story.
Thank you. Thank you for having me. Okay, well, it all started at 43. I went to a doctor's office because I was experiencing hot flashes, night sweats, everything I didn't think of. I thought it was menopause because at 43, you know, you go through menopause. The doctor gives me the big news that no, it's not menopause, you're pregnant. So I went through that bit of shock at 43. Then 2 years after that, 45, I started having the symptoms again. So the symptoms got a little more intense. There were the night sweats, the same routine, but I got anxiety. So with all that, you know, anxiety, and I didn't know I thought I was going crazy. Again, I'm having symptoms of menopause. I went to see a doctor and that person said to me, oh, you know what? You're probably going through menopause. Why don't you have a little low dose of Paxil? So it worked. So I was like, okay, I don't have to go on hormone pills. I went on Paxil. 8 years later, I'm sitting in my bed watching Netflix and I start getting burning, tingling sensations in my tongue, palpitations, and it was like heartburn palpitations. So I thought I was having a heart attack. So I'm like, okay, now I'm having a heart attack. So I called a friend who's also an MP, and she tells me, Janette, you're going through menopause. So after she said that, I calmed down a little because I'm like, okay, it's menopause. all right, but it was something horrible. I thought I was going to die. I thought that was it with, and it happened to be menopause. So I've been through a lot of issues with menopause, a lot of symptoms.
So Janette, can you tell us a little bit about your experience of having a pregnancy when you thought you were really going through menopause? What kind of impact did that have on you, your psyche? I mean, this is a lot. And considering that you said 2 years after having the baby, you started having all this anxiety and depression. Could you talk a little bit more about that for us?
I'm thinking, I moved from New York to another state. So I'm thinking maybe all that together with the panic, like the anxiety and all the stuff that I was having. But the night sweats and the the hot flashes and everything did not stop. So I was like, okay, then something got to be wrong. So I went to see the doctor, and the doctor said, I said to her, I don't want to be on hormone pills because, I just went through a hysterectomy too after the baby. So
Ah.
I was scared. Yeah, I only have one ovary, but I thought that had to do with the symptoms or whatever, because I still kept one ovary. But no, it was menopause. So everything I had has been menopause.
So you were talking about, I happen to know you and experience a little bit of those symptoms with you where
Yes,
you really thought you were going crazy. The mood swings. I
yes,
remember the anxiety and the mood swings, and that it impacted your job also.
it did. Every Sunday I was crying, nervous. I'm like, I gotta go to work tomorrow. And it was really, really bad to the point that I thought I had to go see a psychiatrist because I thought I was going crazy. And, I'm not crazy. I'm here. It's menopause.
So, how did you deal with that with work? Was there any understanding about your symptoms and your kind of your mental health state at that time? Because sometimes that's really difficult for women to experience those symptoms and not really know what they're going through and not really have the support from the work environment. Did you have support there?
So I tell you, I started that job when I was getting all those symptoms. And so I
Mm,
really couldn't tell anybody. Plus, you know that if you tell someone you're taking Paxil, that's it, you're crazy.
that's right.
So
That's
I
right.
kept it quiet. But
Yeah.
I lasted at that job 7 years.
Good.
There was a point that I needed a fan, and I needed a fan. I need to fan myself because as I was sitting there talking, at first I was a supervisor at that job. So
Mhm.
as I was talking to my employees or whoever, sweat used to come out of my face. I mean, I had my makeup on and the sweats used to pour out. And they were like, Jeanette, what's wrong with you? So, little by little, people knew that I was going through
Were you
menopause.
able to talk about the menopause? Were
Yes,
you able? Okay.
then,
Okay.
then at that, because a whole bunch of girls.
Yeah.
There was no men there.
Yeah.
And they were all not my age, but they were all reaching, so they knew what I
They,
was going through.
yeah. So
And
what
look,
did you do
menopause.
to help try to with the hot flashes? Did your girlfriends tell you some things? Was the doctor helpful for that? And sometimes the medication like the Paxils will help with that
Yeah.
hot flashes. Did that help as well?
Yes, I continue to
Okay.
take Paxil. To this day, I take
Okay.
Paxil. I
Okay.
have never been on hormone medication, but if I needed to, of course, but I have
Yeah.
never been. But I just sat there and fanned myself until it went away and just relaxed until it
Okay.
went away. So
Okay.
it's hard and it's kind of embarrassing when
Yeah.
you're the only old lady there going through this, and they're all young girls. So, but they understood. It was
Yeah.
good. They were
Yeah.
good.
Very good for that. Yeah.
Jeanette, I am, and like I said, it's almost embarrassing because I feel like each time that we meet with and have guests on the show, there's somebody in a story that I can relate to. So I had a similar experience, and I had just changed gynecologists, and my gynecologist did prescribe me Paxil, and she said in lieu of hormone replacement therapy, and like you, I was like Paxil, and it's like your mind automatically, for me, kind of went to, well, why am I getting? Isn't that for anxiety, other things? So
Yes.
I was very reluctant to take it. And I don't know if I got in my head or if it was really a fact, but I did do it, but I only did it for like like probably a week. And I honestly did get headaches from it. And I called her and I said, I can't do this. I'm getting headaches. And but I don't know if there was something mentally there just because I didn't want to take is it considered an antidepressant? I believe
It is.
Yeah. And it's
something.
hard. It's hard for some women to take sometimes. I mean, it can, make
Is
you
it?
feel,
So, yeah,
you
it
feel
didn't work
off.
for me.
Yeah.
Yeah, it
A
didn't work
different
for
kind
me.
of
It gave
off
me
than the
headaches. Yeah.
anxiety. Yeah.
Yeah. And so, but I'm happy to hear that it worked for you, because this particular doctor that prescribed it for me, she actually said that she had been taking it and we're about the same age, and she said that she had been taking it for years, which is why, she had prescribed it for me.
Yeah.
But when you said that, oh, you don't want to tell anybody you're taking Paxil, I mean, I can kind
Yeah.
of relate, because I was just like, oh, do I really want to take that? So, but I'm happy to hear that it did work for you. And, maybe I just wonder if maybe I was in my head, but I really did get headaches. And when I stopped taking it, I stopped getting headaches. So I think there was a correlation there. But yeah, so I just
Yeah.
wanted to share that.
Paxil is very common. It's one of the FDA approved for hot flashes for the perimenopausal woman, as well as if you have hot flashes and anxiety. So sometimes it is the perfect choice. However, and I'm not sure if you know, Janette, but I also have an interest in functional medicine, which seeks to offer remedies at the root cause of a problem. And what a lot of women don't realize is that when the microbiome of the gut is imbalanced, when our estrogen gets low during perimenopause or menopause, it causes a shift in the microbiome that affects our serotonin and dopamine. So that's our internal neurotransmitters that the Paxil's balancing. Well, you can also do that as well by taking a look into the microbiome and replenishing, targeting those bacteria that control anxiety, depression. And so that's all done through supplementation, not medication. So it's not a mainstream in the doctor's office. And I like to say that because there are a lot of women who, like Sonia, you've done well with it, but there's groups who don't do well with it and otherwise feel like they don't have any options. And so that is an option to say, I couldn't take the medication, or I don't want to take the medication. Is there another way to do it? And that's the whole goal behind the functional medicine.
Okay. Yeah.
Go ahead.
I don't know if it's correct or if I'm doing it the right way, but when I do take the Paxil, I don't take it every day. I know when I'm feeling that things are not right and I'm gonna have these hot flashes, and I will take a pill. Some people are like, "Aren't you supposed to take them every day?" I'm like, "No, I take them when I can, when I need them." But I'm so used to all the symptoms and everything that goes on that I know when to take a pill. I know when I need it. So.
And that's what I'm saying, that you haven't had anxiety your whole life, and this hasn't been something that you've battled. It started during the imbalance of your perimenopause. And I just want to, you might even want to consider taking like a sort of a broad spectrum probiotic, and give it about 3 months on that, and then see if your need to take the Paxil becomes less and less. Now, that is guessing. So if you take a probiotic, let's just say like a 50 billion of a probiotic, it typically has the two microbes in there that control balancing your serotonin and dopamine, just like your Paxil does. And so if you tried that, you may find that in 3 months of being on that, I haven't even had to take my Paxil. And that's the whole point behind. And can you do what you're doing? Absolutely. But you might want to consider, maybe I should, kind of adjust my gut health a little bit and come off the Paxil altogether.
I think that's really a good point. And what you just said, Kathy, about her not having had anxiety all her life, and then all of a sudden developing it. And when, Janette was saying that how much she thought she was going crazy, which is what in practice, that's what I heard a lot. Women who came in and said, I feel like I'm going crazy, and why someone would get started on something like Paxil, because of this is something completely new, but it has to do with menopause.
Yeah. Well, and for most women, what precedes it is a year or 2 or 3 of stress. That stress, then when you go into the perimenopausal years, which is another stress, that's what disrupts the microbiome or the healthy gut bacteria that otherwise would have been controlling the balance of the serotonin and dopamine. So you'll see it. So she had a pregnancy, she had a baby, she
Yes.
had a toddler, then she was
Have teenagers
perimenopausal, and she had surgery, and then
and the
she had
teenagers and the
and teenagers, and all of that insult. Or what we do, it happens subtly, but then when we enter perimenopause or menopause, we crash, but it really has been there for a long time. So that's why in her instance, if the medication is working wonderfully, but I really think it is a message that women need to hear, because there's a whole set of women who just can't, like Sonia, can't take it. You have to consider the other options, and the other options would be, more towards focusing on the gut health.
When you say you thought you were going crazy, was that more like brain fog, or you just thought like you just couldn't get yourself organized, or things were going like, I mean, was it,
I
or,
was crying all the
oh,
time.
the more you, okay,
I started a
gotcha.
new
So it was
job,
more
like I
emotion.
said.
Okay. Yeah,
Yeah.
I was
So
just
it
curious
was the
because, yeah,
job. I had to
yeah,
learn new things.
gotcha.
And
Okay.
then, I'm here alone trying to like raise a baby.
Yes.
So everything, I used to cry a lot. I'm like,
Yeah.
why am I, so nervous crying? So yeah, I really thought I was going through the crazy emotions
Yeah, and
Yeah.
due
that's
to
that's
that.
that's tough. That was a
Yeah.
lot on your
It
plate
was
at
a
that
lot.
time,
You,
You could
yeah.
probably drive your car and listen to a commercial and you cry, just listening
I
to,
did.
and
I have.
been there, done that. Yeah.
Yeah.
Yeah. Yeah, that it's a tough time, but
Yeah.
I know for me, I suffered a lot from just like the brain fog, because I'm someone that's typically very organized and could just, just kind of always could manage and juggle about 1,000 balls at one time, and able to keep it, keep it going. But then all of a sudden it was like, oh my gosh, the balls are hitting the floor. I can't catch them as quickly as I used to. So for me, it was more the brain fog. So that was why I was just asking for our listeners just to get clarity there.
Yeah. Yeah. Brain fog's a big one also. A lot of
Yeah,
women
no,
have
it's
that.
huge, and yeah,
It's
it's
making its
real.
way up
It's
to that top
crazy. Yeah,
3. Yeah.
yeah, yeah.
Brain fog a lot of times has to do with the cortisol. So a
Hmm.
lot of women who have brain fog will say, I wake up at 3 in the morning, I'm tired, but I can't sleep. So we call it wired and
That's
tired.
me.
And then
Wired
what
and
That's
tired.
me.
happens, you have to get up and you're mad because you just fell back to sleep 30 minutes before you have to get up. And it happens night after night after night after night. And that really
Very
becomes a
nice.
cortisol issue. But let me just say one thing about that. Cortisol as well is controlled by the microbiome, by the balance of the microbiome. And so you could have tests done, and then, they either be normal and then there's no solution, and you're still looking for, well, maybe I should be on hormones, or maybe I should add this, when really the answer to it is in our gut health.
Hmm.
Wow.
Yeah.
Yeah, and Janette, I want you just to talk a little bit about the tingling off the tongue. I mean, you got me when you started talking about
So
that.
weird.
Really share that experience for us.
So, like I said, I was like, watching TV, sitting in my bed, and I started getting like this. It was like at first like an itching, tingling sensation, but then it started like being like it started being like pins and needles in my tongue. I kept like touching my tongue, putting water on it, and I'm like, oh. So I started Googling it. Google's your worst friend. So I got scared, and then I guess because of that sensation, I was like, oh my God, I started getting palpitations or having symptoms of I can't shortness of breath, or I couldn't breathe, and it was like very painful. So I was like, oh my God, I might be having a heart. Let me go. The emergency room is right down the street, guys. So I just run to the emergency room.
Absolutely.
And I'm like, oh my God, but that I never felt like anything on my tongue that was so weird. Especially the way it was like tingling and burning, and it was everything, like everything happening in my tongue, on my tongue. And I started getting palpitations. So I thought it was because I'm stressed now because of the tongue issue. I'm like, and it all happened at the same time. So I called a friend that's a nurse practitioner where I used to work. And thank God they're all my friends, right? She's like, Janette, that is menopause. The same thing happened to her. And I was like, the tongue? And she's like, and the heart attack, you're feeling like you're having a heart attack? That's menopause. And I'm like, are you kidding me? So I don't know if I did. Well, I went took a Paxil. I don't know what I did that night. I really don't remember because it was a while. And I relaxed after she told me that it was due to menopause. So you see how everything is like in your brain and you don't want to see it's mental, but
Yeah.
it is kind of mental. You know, you're like, oh my God, I'm going to die. As soon as she told me it's menopause, I calmed down.
Yeah. I don't think I don't look at it so much as mental. That's normal.
Normal.
You know, even a little thought is, let me center myself. Is this a heart attack or a stroke coming on? Especially for women of color, is that we do have to kind of have that heightened alarm about could this be a heart attack or stroke, because that's the number one killer, especially for African American women. I think, and also during the perimenopause period. However, or menopausal period, but if you're symptomatic, hot flashes, and you're having some other things, then yes, it's most likely that. But we probably, if there's any question, or if it goes on and you've not talked to somebody, and this is for our listeners basically, is that you definitely want to, mention that, to call a friend who's a doctor or a nurse practitioner, or go in and see your provider, just like Janette did. So
yes, it could be anything else. I had symptoms of hot flashes and or feeling in my stomach wheezy and all that, and it happened to be a small bowel obstruction, so you can't really, sometimes you're like, oh my God, what do I do? But if you're really feeling it, like really, really bad, I would recommend for them to go to the hospital, because you just don't
We
know.
have to learn
And menopause
to
is so
listen to our
tricky. There's a
bodies. I
lot of
mean,
things.
I think it's so
So
important. And I think as women and Black women, a lot of times we've been faced with times where we may have gone to a doctor and the doctor doesn't hear us, or we're saying, this is what I'm experiencing, and they try to minimize or say, or dismiss it. So, we get into this role where we say, oh my gosh, is it me, or is there something like, you're like, oh my God, it's mental. But I mean, we've all been there. And I think that sometimes as we get older, and maybe when we're comfortable with the doctor or whatever, and you're like, but I'm not feeling heard, because I know for me, I had to change doctors like 3 times because I felt like they weren't hearing me or listening to me. So I think, like you said, I mean, I always err on the side of caution. And if I feel anything different from my body, I mean, at this point, we're all at a certain age in life where we know our bodies, and we know when something feels off and it doesn't feel normal. And so I try to really listen and pay attention to when I notice a change. And it sounds like you have done exactly that as well. And I think we, as women of color, should continue to do that, to listen to our bodies. And when we're in situations where we feel like we're not being heard, that, we pay attention to that. Yeah. And listen. And maybe we do have to make that tough decision and say, I need to go to see another doctor. And, which is, it's uncomfortable. You don't want to start all over. You feel, you've been seeing this person, but sometimes it may get to a point where you have to make that choice and say, hey, this person isn't hearing me. I need to go to someone else that can hear me and listen to my concerns. So, yeah.
Yeah, I think that's important. And we always talk about the SWAN study, the study of women across nations. And one of the things, just like Sonia said, is that they highlight that, okay, so why are African American women affected more and die more from heart attack and strokes, or events that they present to the emergency room? It's because they're, I don't know if I would say the word believe, but they're not heard. And so it might take 3 visits of going back before you're heard. And so we end up having more traumatic events after our complaints because the initial treatment, or because, I've watched sometimes, you could have, some would order a cardiac workup right, right with the first events, rule it out, you're safe, you're fine, and then, move on from there. So I think if, just like Sonia suggested, if you're not being heard, and again, if you have a second occurrence of that symptoms, I would certainly find someone else to talk to.
And I think it was great, Janette, that when you talked to your friend, that friend had the same experience as you. Because when I heard your story about the tongue tingling, I had not heard that before. And for you were just fortunate that you were able to talk to your nurse practitioner friend who said, you know what, I had that same experience, and it ended up being menopausal symptom. Kathy, you may have heard this before, but I had not.
Well,
I've not heard
I
that
know
one either. No, and I've not experienced that one. And we know I've experienced a lot, but I haven't experienced that one. That's the first. So
well, and here's the thing: I've been doing this 30 years, and she's the first I have heard. I knew it's a thing, but she's the first that it's happened to. So it had to be super scary, and
and embarrassing.
Well, yeah,
because you're like, okay, now do I tell anybody that I have pain in my tongue and tingling?
Yeah.
I mean, that's weird. So, I mean, thank God I said, okay, let me call my friend and see if she can tell me what this, or what can I do, or is there a liquid or anything I can put on my tongue? Because I really thought it was maybe gums, or I had to do my mouth, or I didn't think it was menopause. I honestly did not.
Yeah, and a lot of times it has, they will call it a paresthesia, the nerves in your, or dry mouth or something like that. But it isn't a phenomenon that's associated with falling estrogen. So, for any of the listeners who may be experiencing that, and if you're having hot flashes and irregular cycles and you're between 45 and 55, think about that being perimenopause.
And that's why we're doing this too. I mean, because, we want to, there's so many symptoms out there. I have just discovered symptom after symptom after symptom. Of course, hot flashes is what the thing that everybody talks about, but there's so many other symptoms out there. And that's why Denise and Kathy and I decided to do this podcast, is because we wanted to be able to help listeners and help others that may have symptoms that are less common, that are not so, talked about as frequently. So, thank you again for sharing that. Because again, like I said, I thought that I had experienced, I know that I've had at least 75% of the symptoms. So.
She's our poster child.
I'm happy to know there's one that I haven't had.
Oh my God. And I hope you don't get that one either.
Yeah, me neither. No, me neither. I don't want that one. No.
Well, sometimes we were talking about your doctor, nurse practitioner, PA may not be familiar with some of these symptoms, and it's not that they're not hearing you, we're just not knowing, because had Janette come into the office to see me, I would have been baffled about this whole tingling tongue business. So sometimes we have not been exposed, we have not heard, we have, even though it's out there, we may not know. So I'm just glad that you had someone who was able to calm you down because of that.
Yeah, it's very scary. That was a scary situation, but thank goodness. And it's good to know, once you're like, okay, oh yeah, that's the, you relax. There was many times that people talk about menopause, and I wouldn't talk about menopause. I'm like, now anybody talks about menopause, I'm like, yeah, are you getting, I'll talk back to them about it.
Isn't
but I think
that
it's
amazing how that's changed? Because nobody talked about it. That's why we're all now, our generation, nobody talked about, but guess what? All these younger generations, they're going to be talking about it like they talk about periods or whatever. It's just going to be common dialogue, everyday talk. Yeah.
Yes. Hysterectomies.
Exactly.
Menopause. That just wasn't taught to in my Dominican home. My mother would not talk about that. I know about it. I had to learn myself.
Yeah. So, my mother never talked about it. I don't even know. But then again, I had a mom that my mom didn't talk to me about a lot of stuff. Like, our conversations about, periods and stuff was very, like when I got my period, like she didn't So I don't even
Very
know, and
unique.
now my mom has dementia, so I can't be like, Mom, when did you start going through menopause? I have no idea, so I don't know that family history or what to expect. So yeah.
Well, I
Yeah.
think historically it was not something to be proud of, in our mothers and grandmothers' generation. And I think they just didn't talk about it.
Yeah.
And they also had probably a little bit more balanced life. We've got much more
That's
stress.
true.
Our foods
That's
are
true.
different.
That's
And so the way in which our body processes and processes toxins and all of that is a little different. So on that hand, because a lot of even asking your grandmother, a lot of them would say, I know, I don't think I ever went through that, so, but I'm glad that we are able to do it. I know that when I went through probably 15 years ago or so, it was a shameful thing, because I was 45, 46 and that was not, and that's when I started the hot flashes. And that was just not something to be proud of, or that you would, you felt like you would be deemed, over and done with, at that point. So, and so to have a platform like this, to be able to openly talk and laugh and know that it's normal, really empowers us to be the best that we can be moving forward.
Very true.
Janette, you talked about coming from a Dominican background, and and, and and these things are not spoken of at all. And so now I talk about things that are not spoken of. I know that you had some other symptoms that you were willing to share about, and which I'm sure your mom would never have talked to you about this, but you were talking about vaginal dryness and sexual issues and so can you tell us a little bit about your story with that?
Well, I don't know if it was menopause, but before Caitlin, before my baby, I had a lot of vaginal dryness, painful sexual activities. The whole, I didn't like sex. I don't know if that's bad or good. I didn't enjoy it because of all the things that were happening. Um, I went to the doctor a lot for a lot of, dryness, itchy. It was just a lot of stuff, and it's all at 40. After 40 something, it started getting like that.
Were you having
Then
regular cycles or irregular
yeah,
cycles?
I had
They were
regular
regular?
cycles.
You were having
Always
regular
had regular
cycles. Okay.
cycles.
All right.
And I was always at the GYN. It feels like I was always there. I thought that's why I thought I was going through menopause. So when before Caitlin, I was having all the sweats, the night sweats, waking up drained, in the water, and then the dryness was always there. It was, always. I used to buy lubricants. It didn't. It was always dry. So or having sex was very painful. But I thought it was all menopause. So when I came out pregnant, that I went to the doctor and said, listen, you have to give me something because I'm going through menopause. And he's like, no, you're going to. I think that I was going through a little menopause right before Caitlin and then had Caitlin. I don't know if that's normal. Or if
Your
that's
last
after.
hurrah. Yeah.
Yeah, I think, a little bit. I had a little bit, and then I had Caitlin, and then again, it came back. I think menopause doesn't go away because they're like, oh, in a year or two. I have been 10 years almost suffering with this. 10
Same,
years.
same.
Yeah.
I'm probably closer to
So
15.
it's hard, it's horrible, but it's okay because it's something that it is normal. So, it's not like you're gonna die. You're gonna be okay. You can, you can get through this. But yeah, I had a lot of issues having sexual activities. I really
Did that
didn't enjoy it
improve
because
after having the baby?
um mm, uh, maybe
Is it better now?
it's
Are, are
better
you
now.
are
Yes.
you are you on some type of hormone
Mhm.
replacement for? Have you ever considered that?
I honestly can tell you that after the hysterectomy, this is another thing that women think that because you had a hysterectomy, you're not going to feel like a woman, or it's not going to be the same. Or I've had better sex than when before. I don't know.
That's good. Good for
Yeah.
So
you. Look,
That,
good.
that
I
Good
haven't
for
felt any
you.
dryness. I don't feel any. It's not that bad. It's not bad like that anymore.
yeah.
But it was right before Caitlin. Yeah, I felt and I felt like that was menopause. And it was not only like a month before, years, like 2 or 3 years, I was feeling all that. So that's why I said, I thought I was going through menopause and I wanted the doctor to give me any hormones or whatever I need to do to make me feel better at that point. But I was pregnant.
Yeah, but that did not improve, or it stayed the same.
The
dryness, the dryness and that issue.
Right now I am not sexually active, unfortunately. So I can't tell you if it's,
Yeah, because let's just say if you do, there is, and you could just talk to your doctor about it. There's a plant-based bioidentical, either tablet for the vagina or suppository or cream that you can use that gives just a local treatment to that area for complete rejuvenation. So that's something to consider if you become active again or start having the leaking or pain or anything like that.
Yeah. I'm just gonna say, and something that it's very common because I know, Janette, you just said you're not sexually active, and I feel like that's the other thing for a lot of women in our age group right now. We're not that sexually active for whatever, a number of different reasons, but I feel like I feel like my vaginal dryness has gotten better because of some of the other things that I'm doing. Because I do take hormone replacement therapy, and I do use, like Kathy said, the creams. But and I don't even know if they know this because I don't think we talked about it. Because it was so bad for me that I went and got a treatment called the Mona Lisa. I did that whole thing like a year or so ago. And honestly, it did help. But then I was like, but I feel like it was a waste because I'm not that, I don't have a real partner. So I'm like, well, doggone, if I get with really a partner, am I going to have to go do that all over again? Or hopefully I won't, that what I'm doing now will kind of help maintain.
Yes.
But I definitely saw a difference after doing that. But I'm not recommending it or anything because it's pricey, or whatever. And it's a series of treatments and things. But I just only brought that up because you were saying, well, I'm not that sexually active, and I'm like, that seems to be a recurring theme. I'm hearing that a lot. So don't feel ashamed or whatever, because I'm telling you, there's a lot of people that I hear now that, for whatever reason, we're just not. But I'm happy to hear, though, you said that it was better after your hysterectomy, because I've heard a couple people say that. You're like the third person I think that has said that after their hysterectomy that their sex was better, the sex life was better, and they weren't so dry or whatever. So I'm happy to hear that. Yeah.
Dry and painful.
And what's important about that is that there are options for that. The Mona Lisa, for those of you who don't know, it is just a radiofrequency treatment that's used. It breaks down the collagen and then rebuilds it. It allows it to rebuild. So it gives some lift and tightness to the vagina, as well as rejuvenates the tissue layers and the moisture glands, the glands that produce moisture. It's especially useful when you use it along with the vaginal hormone replacement therapy. So even after that, the fact that you're maintaining it by using the hormone replacement, if you would stop that, then the effects of it can go away. But it's certainly a great treatment, especially for somebody who may have had some laxity or leaking of urine or issues after childbirth. And it's an alternative to surgery if you don't require surgery.
Yeah, so it's
and that was one of the reasons I got it too, because I was having obviously you guys know the urinary issues, and also it was a combination of things for me, both to kind of help with both. Yeah.
Very good.
So it's mechanical rejuvenation, with a machine in a doctor's office. It's stuff that you have to go in to get done, and like
and you have to go
said,
three times too.
Exactly.
It's three.
Yeah. And it's pricey. It's pricey.
It is, yeah. It's not covered by insurance, so yeah.
I would probably use, especially for a menopausal woman, start with ask your doctor for some of the plant-based bioidentical hormone treatment first. And if that doesn't solve the problem, consider maybe pelvic floor physical therapy to, help some of the issues. And then possibly based on that assessment, maybe a Urogyne consult or the Mona Lisa or surgery. So the Mona Lisa kind of is up there, could be considered after those other things have been done.
And I would agree too. Again, I wasn't advocating or saying that anyone
Oh,
should
no.
I
Yeah.
was just saying that was my experience.
Yeah.
But I definitely think the order that you gave them, and I think, for me, it's the easiest, least expensive is to start with the estradiol or something like that, because it does work as well. So, and I can attest to that.
Yeah. And I think for someone who just wanted the Mona Lisa for whatever, for reasons, it's not a bad thing. It's a great, we used to do them just routinely.
Yeah.
But, and then, there's a whole maintenance part of it. Once you do your 3 treatments, then really every year, or every 2 years, you're supposed to come back for a maintenance treatment again.
And see, that's the part. That's why I said it could get costly, because I'm thinking, okay, so it's been a year. I'm like right at about a year now, but I mean, I don't feel the need to have to do it right now. But I mean, at some point, but again, like I said, hopefully I won't, but if I need to, then I do know they recommend that you come back, in a year or 2 for a maintenance or whatever. So
Janette, just want to go back a little bit where you talked about the fact that you got a hysterectomy, but you still had an ovary, and you mentioned that you people think when you get a hysterectomy that you feel less of a woman, and I just really want to highlight what you said, because you said, no, it wasn't like that. I kept an ovary. I still had, some hormones on board, and I had a better sexual experience after having had the hysterectomy. Why did you have the hysterectomy?
I had a history of fibroids, my uterus. It's since 2002. I had a myomectomy. I had a few things I needed to, and it went down to having a hysterectomy. I had a low grade of cancer, they were saying. So not only myself, my sister, my mom, we all had to get a hysterectomy, and I was the last one. But they used to say that, oh, you're not gonna be a woman anymore. It's, and you could grow up thinking that, but it's not.
We've had that conversation before, because you know where that came from? That came from in our mother and our grandmother's generation, when they had hysterectomies. The thinking, really, probably more than 30 years ago, was that when you have a hysterectomy, if you were over 35, take the uterus, the cervix, the tubes, and both ovaries. And so 35-year-old women were basically castrated. So those women who had hysterectomies would just go into full-blown menopause, lost their sex drive, did not feel like a woman, because their hormones were removed at such an early age. Well, when I went through residency training, the thinking began to change, and no, now we don't take ovaries out unless they, there's some type of disease process, until about 65. We offer it. A 60-year-old woman could say, yeah, I'm having a hysterectomy. I have a history of ovarian cancer. Take them out. Ovarian cancer in the family. Or we leave them, because we do know we still, even after menopause, have some hormonal balance that we benefit from, so we don't routinely take them out. And so that's where that came from. I had a hysterectomy when I was 40 for large fibroids, and it was the best thing I ever did, other than my son. That's it. I'm telling you. And, I was anemic, and to be able to walk around with a full blood count, because of the fibroids. So anybody considering it, nowadays it's done through the belly button or through the vagina. If your uterus is small, it's an outpatient procedure for most women, unless the fibroids are large, and we typically don't let them get that large anymore. And we leave the ovaries, and you could actually leave your cervix if you want. So it's an outpatient procedure that really is life-changing.
Wait, they're doing
I feel it better.
hysterectomies as outpatient now?
Yes,
Uh,
ma'am. I
let me
did them
give
for
you a
15
date.
years. I did them
I
for
thought that
15
was
years
like,
as
I mean,
outpatient.
people used to have to take off like 6 weeks of work, and isn't
Oh, no,
that
the
like,
recovery
wasn't
is
it?
still there, but
Well, the
Yeah, the
recovery is still
recovery.
there. So when you do it
Oh,
when you do it laparoscopically through the belly button. So I used to do it laparoscopically, and I didn't round on a patient in the hospital for 15 years because all my patients would go home that same day, 2 to 4 hours afterwards, and we would allow them to stay home for 4 weeks, but they're up and driving 5 to 7 days. Kind of, you have to remind yourself. I had a hysterectomy.
yeah, yeah.
Slow
yeah.
down. But no, it's so there's no reason to be anemic, to suffer, to carry precancer cells, to have hold on to that uterus, especially if you're finished having, you're done having children.
That's
If
right.
you want it, there's no reason
Wow. I
to
didn't
do
know that.
that. Yeah.
And now with robotic surgery, it makes it so
That's what
much
I
easier.
had.
Yeah,
That's what
yeah,
I had.
yeah, robotic
Robotic.
surgery. And now you're
One
within a
day.
week, you could go back to work if you really want to,
Yes.
you know?
If you're good. Yeah, that took two. But yeah, it's easy. Get 2 weeks at least. But it
Uh-huh.
was
Can
very
you
easy.
imagine? They
Very
used to
easy.
take 6, and now you're saying down to 2. Wow. But yeah. We don't want to rush ourselves back.
Well, and they
That's
Yeah.
still
the other
give
thing that we
you,
as Black women do. We say,
yeah,
"Oh, I got to get back
I'm
to work. I
good.
got to go. Oh, I got, but we need to take the time." So I'm not again, I'm just,
yeah.
I didn't know that they could do it, as outpatient surgery. But again, I mean, we need to again listen to our bodies, take the time. But yeah, but I mean, I'm happy to hear that, because I know a lot of women back in that was one of the reasons, at least people that I used to hear, like, oh my God, I'm going to be down for, whatever. But yeah, so.
Yeah, most insurance companies, or the disability policies at work allow 4 weeks. So I encourage people,
Oh yeah,
patients to
if
take
you
that
can do
4 week.
it,
Take
why
it for
not?
me.
Especially it's
Absolutely, let your body
stressful. We
heal.
live in
Yeah,
times that are so stressful now, and I think phones, cell phones, and all. We just live. We're never really able to shut it off. To shut everything down and turn. We can't separate work from our personal lives
Yeah.
because we're constantly at
Mhm.
somebody's texting us or whatever. Where back in the day we didn't have cell phones. When at the end of your day you were done until you started again the next day, but we
Mhm.
don't have that. So I'm a firm believer of me time and taking time for ourselves and de-stressing and all of that stuff. So yeah.
yeah, and it's that stress that really is pulls the trigger on a lot of things that we go through
Yes,
these days. It's how we go through
absolutely. Oh
menopause,
yeah, yeah.
how our bodies,
Yes.
whatever imbalance or illness that we're dealing with, a lot of the times it's the root of it is coming from the
It's
stress.
stress.
Yeah.
Absolutely. Yeah, yeah.
Well, Janette, thank you so much for joining us and sharing
Thank you
your
for having
story.
me.
Yeah, and hopefully, having heard your story will shed some light on the weird, for lack of a better
Fun.
term, things that you went through and how they were related to menopause. Ladies, do you have any further questions, comments, anything else that we before we wrap up with?
Well,
Go ahead.
yeah, I just wanted to say that I was happy to hear her story because of what she went through. That so many women, again, would be sent away and not heard, or not would not know how to advocate for themselves on something
Mm-hmm.
that just didn't seem right. And
Mm-hmm.
so just to hear that, all of the other ladies that may be experiencing those kind of
Yes.
things, hopefully that gives them the to continue to seek the support that they need.
Yeah, and realizing that menopause is a very unique time in life, and that although we don't want you to discount any of your symptoms, like we've always said, go seek medical attention, but also realize that we're educating ourselves as we go along as to symptoms that could be because of menopause. And so hopefully, this has been educational, informative for our audience, and stay tuned. We've got many more episodes to come, and please share our podcast with your friends. Any other women who may have mentioned to you any of the symptoms that you're hearing today, pass on the podcast. We would love to be able to
Awesome.
impact as many lives as we can, and especially women of color.
Thank you, Janette.
Thank
Thank
you,
you guys for
Janette.
having me.
Wonderful
You guys-
story. Thank you so much.
Thank you for having me.
All right. Bye-bye.
Bye-bye.
Bye bye.
This is
Menopause Diaries, real talk, real stories.
Thanks for listening. Let's thrive together through every
Hot flash.
mood swing and sleepless night. Don't forget to like, share, and subscribe to Menopause Diaries, Real Talk, Real Stories. If you have questions or want to share your story or would like to be a guest, visit us on Instagram at Menopause Diaries Podcast. Let us start a conversation and navigate this journey together.